Hello, this is Tracey Bennett. I'm doing my skills competency for field trip permission. I'm going to talk through the various ways of administering medicine, starting off with oral medication. First thing I would always do is review the 6 rights: the right student, medication, dose, time, route, and documentation. I would make sure to pour that oral medication either in the lid of the bottle or into the student's hand so that I wasn't touching it, or a disposable cup. I would make sure there was water on hand afterwards as well, and verify that they swallowed the medication by checking their mouth or having them open their mouth. After all medication, I would put that in the medication administration record, lock the medication up, and observe the student for any side effects. For liquid medication, I would obviously again begin with the 6 rights: student, medication, dose, time, route, and documentation. I'd measure at eye level. I would pour it so that the liquid doesn't get on the label, and definitely check the dose again. I'd give the medication to the student, again verifying that they'd swallowed, and then document that in the MAR, replace the medication in locked storage, and observe for side effects. For eye drops, I would review the 6 rights again: student, medication, dose, time, route, documentation, put gloves on, stabilize their head by having them lean their head back, having them look upward and form a little pocket at the eyelid. By pulling down the lower lid, I'd put those drops into that pocket. I would not touch the eye or the eyelid. If it was ointment, I would apply that strip of ointment in the pocket, have the students close their eyes for a few minutes, dab away any excess, take off my gloves, document it in the MAR, replace the medication in a locked area, and observe for side effects. For ear medication, I would review the 6 rights: student, medication, dose, time, route, and documentation. I would loosen the lid and squeeze the rubber stopper to fill it. Then I would have the student, I would stabilize their head by having them move it to their shoulder, and I would pull the top of the ear cartilage back and hold, and then place the prescribed number of drops into the ear canal without touching the ear. I'd have them remain there for a few minutes to avoid leaking, take my gloves off, document it on the MAR, replace the medication in locked storage, and observe the student for side effects. For a topical medication, I would review the 6 rights: student, medication, dose, time, route, and documentation, put on gloves, remove the medication cap, and put the correct amount on a Q-tip and apply the ointment directly to the area. I'd cover it if it asked me to, remove my gloves, document that on the MAR, replace the medication in a locked container, and observe student for side effects. For nasal spray, I would review the 6 rights: student, medication, dose, time, route, and documentation. I'd have them blow their nose first. Blocking a nostril, have them block a nostril with one finger, insert the nozzle into the inhaler of the other, into the other nostril, spray it upward, and instruct the student to exhale. Squeeze the inhaler quickly, and then instruct the student to inhale. Repeat if needed on the other nostril, document on the MAR, replace it in a locked storage, and observe for side effects. Asthma, I would review the 6 rights: student, medication, dose, time, route, and documentation. Shake the inhaler, check that it's firmly positioned in its holder, have students slightly tilt their head backwards, and have them breathe out. I'd have the student place the mouthpiece between their teeth, closing their lips around it. I'd squeeze the inhaler to discharge the medicine and have them inhale immediately. I'd have them breathe in slowly for 3 to 5 seconds. Once they have inhaled, I would remove the inhaler and have them hold their breath for 5 to 10 seconds before exhaling. I'd repeat those instructions for every puff prescribed, document that on the MAR, replace the medication in locked storage, and observe for follow-up for medication reaction. For the EpiPen, I would first of all have someone call 911, remove EpiPen from the tube, remove the safety or remove the blue safety, form a fist with the orange tip pointing down, swing and firmly push it against the thigh until I hear a click. I'd hold it there for 3 seconds, remove the pen, massage the area, give the auto injector to the EMS, and document the administration of the EpiPen. For glucagon, I would immediately have someone call 911, open the kit. I would remove the top, the seal from the vial, remove the needle protector, slowly inject sterile water into the vial of powdered glucagon, swirl or roll but not shaking it, withdraw the prescribed amount into the syringe, insert the needle into the injection site, and slowly inject it. Withdraw the needle after that, and then I would put a little pressure on the site itself, and I would place a used kit. And close the lid. I would also give that to EMS and document that on the MAR. For diastat, I would have someone call 911 right away. I would turn the student on their side, put on gloves, remove the medication, remove the protective cap. I would lubricate the rectal tip with jelly that is in the kit. And I would turn the student facing me and lower their clothing, bend their upper leg forward, separate their buttocks, and gently insert lubricated tip into their rectum. Slowly, I would count to 3 and pushing the plunger until it stops. Count to 3 while holding the buttocks together so nothing leaked. Keep the student on their side. Note what time it was given and give the syringe to EMS. I would cap it first, then document that on the MAR. And then finally, the last one, Klonopin, I would turn their student on the side so they couldn't fall, consult their action plan to confirm dose, drug, route, and administration. I would put on gloves. I would use a gauze pad to dry gum and inside of cheek. Place the tablet in the pocket between the inner cheek and gum or between their lower lip and gum. I would close their mouth and kind of rub to make sure I was promoting it to be absorbed. I would look for the response, consulting their consult the plan again to see if calling 911 is necessary, and document that on the MAR. Thank you.